Margaret Richards.
Can everyone hear me? I'll use my loud former teacher voice the best I can. I wrote a lot of stuff and I don't want to repeat things that people who are smarter and more educated in medical issues than me have already said. I thank you for the attention you're giving to this matter and for being open-minded and to listen to all points of view. I'm a mother of 3. My daughter is 5, will be entering kindergarten this year, and I have twins who are 3.5 in a local preschool as well. Professionally, I've made a consulting career out of teaching organizations and individuals how to collect, interpret, and use data for decision-making. That's what I do. That's my profession. I am not a health expert, but I am a professional in choosing data and assessing the quality of data and helping people be critical about sources. Just because it's written in a number doesn't mean it's true. Not all data is created equal. Some facts are factual and some facts are unfactual. That's just the way it is. You have to know how to look at sources, how to explore metadata, how to understand really what makes data quality. A member of the committee has already pointed out that there's no medical experts on this board, and I really, really, really strongly urge you to seek the advice of someone. When COVID started, I was the president of the board of my children's preschool in Chicago. One of the first steps when planning reopening was to identify health professionals among our parents to help us access and implement the guidance of state and city health and education departments, as well as to answer our questions and those of other concerned parents. Myself, I'm happy to help anyone on the school committee, anybody here who has questions about what they can trust, what they shouldn't. Happy to help you talk about how I have taught others to do that. And when I don't know the answers, when I look at something and I don't know, I defer to my colleagues here. I defer to my friends and family who are medical professionals. I went to Johns Hopkins as an undergraduate. I know a lot of doctors. They are all sick, they're all frustrated, they are all tired of the increasing cases that they're seeing, and I trust them. I also want to point out, among the organizations that have made public statements in support of universal indoor masking at schools are the Centers for Disease Control, the American Academy of Pediatrics, and the Rhode Island chapter of the American Academy of Pediatrics, the Office of the Rhode Island Governor, Rhode Island Department of Education, the Rhode Island Department of Health. I've also been in touch with the Rhode Island Associations of Physicians Assistants and Family Practitioners. Both are in the process of creating statements in support of universal masking in schools. I have a lot more to say. I support the idea of a tiered plan. I think that is absolutely necessary. And I urge anyone who's hesitant, who wants the idea of choice, to come up with a plan for getting us into it and getting us out for it. There are already guidelines. But as someone pointed out, very truthfully, the CD does change their recommendations, and that's good data practice. If you're looking at statistics from 5 and 10 years ago and no one's updated recommendations related to health on those, those are not good sources of data in general. The last thing I do want to just say, because someone made the point about asked about convalescence homes and if we have rates of we're looking at the rates with respect to convalescence home. I have a friend who works in a convalescence home. She is vaccinated, but she has a 6-year-old daughter who is in school here. If she suffers a breakthrough case, which 5 members have happened to my family, 5 fully vaccinated members of my family have had Delta breakthrough cases, she can pass it on to her daughter who can't be vaccinated, who can then pass it on to her school. This isn't, I would love to say that everybody should have their own choice. I don't want my kindergarten that way, but I care too much about my kids' friends and my community to make my personal views guide my decisions.
Thank you.